Go.
Hi, my name's Racquel Beckett. This is my wound care test out video. So I'm doing a surgical incision. First thing I'm going to do is I'm going to review my orders. It's 7 a.m. The morning shift. My patient, make sure it's the right patient. Yep, Alice Thomas, date of birth 10/29/XX. So that is correct. And I also reviewed her allergies. She isn't allergic to anything we'll be doing today. I did give her a medication, Tylenol, about 30 minutes ago, exactly, actually, at 6:30, 100 milligrams PO, Q6 PRN, and because she was having some pain, so we wanted to address that before we did the dressing change, so I'll make sure that has kicked in. And two, when I gave that out, I'd also like to say that I gave, or did the 6 rights of the patient, and then I also did my 3 med checks prior to giving her that. And again, no allergies and nothing I'm using today is expired. So now that I have checked over my order and it's complete, I'm going to grab my supplies out of here. And I'm going to keep this in my sight at all times. So I'm going to need these cotton applicators. I'm going to need a Telfa, ABD, split sponges. For my drain, keeping these in my sight again, nothing's expired. I am also going to need this kit here, and then my sterile gloves. Now I'm going to head into the patient's room. So the first thing I'm going to do before heading in is I'm going to knock. And then I'm going to wash my hands, introduce myself. Hi, I'm Racquel Beckett. I'll be your nurse today. I'm going to provide some privacy by shutting the door or the curtain. So today I'm going to do your wound care, you said, before your family comes on your surgical incision. And then, then you look like you're in a safe, comfortable position. Is it okay if I just move this? Oh, I guess I'll wait on that. And you have your call it for safety. And two, I'm going to check here. Yep, Alice Thomas, date of birth 10/29/XX. So you're the correct patient. You don't have any allergies to saline. And is your pain level doing okay? Yep, I'm not in any pain. Okay, sounds good. We'll continue on then. So I checked my MAR to your band. No allergies. We're good. Is it okay if I move this down?
Yep.
And I want to keep my in my sight at all times. So, is it okay if I just pull your blankets down? I'm gonna wash my hands. Yep, that's okay. So, sounds good. Thank you. Just gonna pull these down here. Is it okay if I pull your gown up?
Yep.
Sounds good. And then I'm just gonna wash my hands directly before putting my gloves on. Keeping my all my sterile items in my sight here. And is it okay if I take the top dressing off? So, yep. So I'm going to take it off with my clean gloves. I just washed my hands prior to putting it on. I'm going to kind of loosen it first. I want to pull it off parallel to the patient, keeping their skin integrity, kind of trying to do it gently, one at a time. And so I'm going to do it out of the patient's line of sight here. And I'm going to assess and make a mental note, or I can tell my partner what I see on here, fold it away from me, and then I'm going to drop that into the garbage. And then I'm going to take off my drain sponge here, assess what I see, fold it, and toss it into the garbage, and gently take off the Telfa, assess, make a mental note of any drainage, and I'll toss that into the garbage. And now I'm going to remove my gloves and wash my hands right away. Make sure my patient's still comfortable, not having any pain, so that's good. Now I'm going to just wash my hands before opening this sterile field. I might move these over just so I can be sure they're in my sight. So wash my hands before opening the sterile field for my sterile gloves. Okay. So I'm just going to grab it out here by the corner, very carefully away from me. I'm going to open that up. Just keeping that 1-inch border is extremely important. Trying to keep the 1-inch border here. Okay, so directly before putting my gloves on, I'm going to wash my hands. I don't want to be reaching across my sterile field at all. I'm going to grab the glove up by just the cuff here. And insert my hand, only again touching the cuff. Alright, only touching the cuff. And now I'm going to grab this one, kind of this way. Only touching the cuff here. Perfect. So got my sterile gloves on, and now is it okay if I just feel, I'm gonna palpate around your wound, and then let me know if you feel any pain, tenderness, anything like that. So no pain with that. Alright, sounds good. And I'm also making visual notes, doing a visual assessment in my head right now of my findings. It doesn't really look like there's any redness around it, no drainage, nothing coming from the drain, so that all looks good. And I'm also going to count your staples at this time. So 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12, 13, and then just make one more. So 13 staples is what I counted. Yep, 13, so I can tell my partner that or write it down. So thank you for letting me do that. And then any other images, so I'm taking my gloves off very carefully, like so. And wash my hands. And now I'm going to throw this sterile field away. I won't be needing it. Okay, wash my hands again here, and then I'm just gonna kind of set all my supplies out for what I'll be needing here. And then I want to be opening my stuff away from me, maintaining that sterile field there, and so I'm going to have my hand sanitizer, so I'm just washed my hands. I'm going to open this away from me. So we'll get this edge off here. So I'm just going to wash my hands and get the rest of that part off. I'm not touching the container at all here, as you can see just here. Away from me. So normally it all comes off in once. Probably if it did that I could grab a new kit, but for the purpose of the video. So I'm going to wash my hands directly before taking out my sterile gloves here. So I'm going to just be touching the 1-inch border here. Very carefully. Just touching that border. Now I can, I guess, wash my hands again, and now I'm going to take out my blue sterile field, just again touching the corner here. I'm going to open it away from me, keeping that 1-inch border. So now I can wash my hands again. I'm just actually going to scoot this over after just washing my hands, only touching the 1-inch border. Alright, so now I'm going to wash my hands again, and I'm going to open some of my supplies I have here. So the first thing, I have my drain sponge. I'm going to open it away from me, keeping the border there. And now I can disregard of that, and then now I can take these out of here as well, keeping the 1-inch border. I don't want to be reaching across my sterile field here, so I'm kind of cornered to it. And then throw that, and then I'll drop this. Into something else I'd like to say is it's very important to keep your hands above your waist when having a sterile field. So obviously the patient is, and so is all of my supplies, and too, when I put my gloves on and everything, opening away. I'll throw that away. And so now I'm going to wash my hands here. Let's see. Wash my hands here before opening my sterile gloves. And then once I get my sterile gloves, I'm going to put my measuring guide, only touching the corners. Here, being very mindful. Keeping the 1-inch border. Okay, so sometimes it gets a little okay, so keeping, now I'm going to grab hand sanitizer directly before. I don't want to cross any of my sterile fields, so I went through here. So the first thing I'm going to do is I'm going to grab the cuff of this glove, only touching the cuff, and at this time I will obviously only keep my hands above my waist. Pull it down just where I can touch the cuff again. Okay. Get as far up as I can with maintaining sterile technique. So now I'll grab this one, again touching the cuff here. use the cuff to get it up as far as you can. Okay, so we're on good. And so obviously now I'm gonna grab my measuring kit and measure, keep my hands above my waist. And so now I'm gonna come over here, both my hands are sterile, keeping an eye on my sterile field here. So like I told my partner before, I'm gonna measure the length. Okay, so again, okay, so it is 11.5 centimeters. So now I'm gonna drop this from waist high into the garbage. And now after measuring, I can grab anything else I need out of my sterile field. I don't want to be reaching across, so there's 3 there, and then I'm going to put the rest in here. Make sure I have all of them. 1, 2, 3, and 4. I don't need that one. Then I'm going to pour my gauze or my stuff over it. Okay. Saturate and gauze. There we go. And then, so now I'm going to clean around all of my areas here. So squeeze it out, and I'm going to clean with this hand from least contaminated to most, one down here, and then I'll drop this from waist high into the garbage, and then I'll grab another one, and this hand isn't touching, so I'm keeping it sterile, and then I'll do one down the other side here. I didn't touch the drain with this hand, so I'm keeping it sterile, and then I'm going to do one down the middle, more of a dab, keeping it sterile, and then, now this hand will get contaminated at this time. I'm going to grab the drain, so I'm going to hold the drain here and do one in a circular motion, cleaning around with saline gauze, waist high, throw away, and so this hand's contaminated, I won't be using it anymore. So now I'm going to pat dry down this side, throw away from waist high, and then I'm going to pat dry from, this side and throw away. And then I'm going to pat dry down the middle, very, very gently, throw away, and then I have one more to pat dry around the drain here, not touching my clean hand, throw away from waist high. So now I'm going to make sure my patient's still doing good. I'm going to apply the Telfa here, and then I'm going to apply the drain sponge here. Okay, and so now I'm going to grab this, put this over here, and I'm also going to grab this with my clean hand, and now I'm going to place this over the top here, and this is now clean procedure, so you can place that down. All I'm going to do is I'm going to tape it for skin integrity purposes. You want to be not use more tape than you need. Alright, so now I'm going to take my gloves off and wash my hands right away. So now I'm going to just wash my hands before grabbing my pencil. I'm going to do the date. It's April 19th. There's 19, my initials, and then dressing change, so 19, 19, and my initials. And now I'm gonna throw that and then place this on here. Wash my hands. I'll cover you back up, and then I'll put your side rail up here. And then here's your call light. If you have any more pain or need anything else, you can let me know. Thank you for your time, and you're in a safe position, so you can call me if you have any questions or anything. So now I just washed my hands and I can do it again. So I'm gonna just document. So the time for the medication was 6:30 because I did it 30 minutes prior. And then we cleaned with saline gauze. We, what else? Used an ABD, Telfa drain sponge. We counted 13 staples. It was 11.5 centimeters long for the length. And then the patient tolerated it well. The time we did this was 7 a.m. I gave her medication at 6:30, and then it is, I'll write the date, 5/13/19 here, and then patient tolerated well, clean with saline, ABD, 13 staples, the length, and then no drainage, no redness, no tenderness, no odor, and I think that is about it for that. And then for the back here, we can sign the nurse's name, actually, excuse me, I signed that on this side. So here's my documenting, so I'll sign my name, Racquel Beckett, student nurse, MSU. And then to the last thing I would like to say, so I have completed my document, signed my name, my patient's doing fine, is just that when opening this, normally I would try and make sure all the sides come off at the same time. But other than that, that is all for my documentation and the end of my video. Thank you.